Hello and welcome to The Human Behind the Healers, where we explore the lives and stories of medical professionals beyond the stethoscope. I'm Geeta Gurung, a third year nursing student, your host for today, and today I'm very thrilled to welcome our very first guest, who is a medical oncologist, an associate professor from Duke University, who has an experience for 22 years from diagnosing life altering diseases to mentoring the future health professionals. Welcome to the podcast.
Thank you so much, Geeta. This is great to be here.
Okay, so how are you feeling today?
Actually, a little anxious. No, but I'm
Anxious?
very excited.
Oh,
I've been here 5 months
yeah,
now,
yeah.
and I'm heading to Kathmandu tomorrow, and I'm just kind of reflecting and just trying to absorb this whole experience of
Wow.
being here with
So
all
it's
of you
been 5 months here in Nepal, in Dharan.
in Dharan. Yeah.
Yeah. So, like, I gave a little bit of introduction about you to our viewers, but so can you please introduce yourself to our viewers?
Sure. So,
Yeah.
so I'm Dr. Melanie Thomas. I'm a medical oncologist from the U.S. I'm at Duke University, which is in North Carolina. And the reason I'm here in Dharan, it's a little bit of a story, but I've worked remotely through what we call a tumor board with your two attending medical oncologists, Dr. Sonia and Dr. Rajiv, through a nonprofit organization called Health Volunteers Overseas. So we would have a meeting usually every week and review cases, and I just learned so much from them about the case, the patients that they have here. And so then a couple of years ago, I learned that the one training program to train new medical oncologists in Nepal, which was based in Kathmandu, it closed. So there was no ability to train more physicians to be oncologists, which is, that's a big problem.
Yeah.
You have such need here. So just over time, I decided that when I learned that Dr. Sonia was going to create a new medical oncology training program here at BPKIHS, I just immediately said, I'll
Yes.
help you.
Yeah.
I'll come and help you. That's a huge undertaking. And so then I started on a path of applying for, financial support and got what's called a Fulbright Scholar
Yeah, yeah.
Award, which has just been incredible. So it's been perfect timing, actually, to be here while, during this time.
We are very lucky to have you here with us today, as well as over this 5 months that we got to know you. And now, like, let's start into a more professional segment.
Okay.
Like, can you tell us about your journey into oncology? Like, what inspired or motivated you to choose this specialty?
Yeah, that's a great question. So I did medical school in Boston. I was
Mm-hmm.
living in Boston at the time with my family. I had two young kids, and I think in medical school, as many students, they go back and forth, this field and that field. Some med students come to med school kind of thinking that they know exactly what they're going to do. Um, I didn't. I really didn't. But I think it was a process. I so it was multiple factors I think that led me to oncology, which I'm really grateful for because it's definitely been the right field for me. But the things that so as you're making the choice, making the decision of what field the decision process, I think is a lot of to do like procedures, the people who go into the surgical fields versus more, I don't want to say intellectual, but more the cognitive field, so internal medicine, pediatrics and so forth. So I liked parts of both,
Yeah.
but then I did residency in internal medicine where you see everything,
Yeah.
and there was just a lot that struck me about oncology. First, obviously, the patients are very compelling, the patients and their family. I loved the fact that the field is so active. There's just so much incredible science that's just coming all the time. So I really like that. I really like to learn kind of constantly. And then I wanted to have a field that I had long-term relationships with patients. Again, that's another thing that people think about. Some people want to have kind of brief, episodic, diagnose a problem, hopefully fix the problem, and then whereas I wanted to have more long-term relationships with patients. And you can definitely have that in oncology. I've had patients for, for years. So all those things really kind of came together, liking the science, feeling very drawn to wanting to help people in a point of crisis in their life when they do get, as you mentioned, a life-altering diagnosis, and then wanting to build long-term relationships with people. So for me, it's been a kind of a perfect field.
Yeah, so that is how we have our medical oncologists as we speak right now. Sorry. Okay. So that brings us to the next question. Like oncology, it's such an emotionally demanding field. And like, how do you balance with the scientific rigor of the work as well as the, emotional aspect of dealing with the patients?
Let me take a minute and think about it. I guess what has, I mean, you've definitely had, all fields of medicine and nursing are challenging, right? We've talked about that a lot before. I guess probably the main thing that drives me is just this compassion, hopefully is the right word, for patients and their families who've gotten this diagnosis. So when I see a new patient, I'm just really very drawn to help them in any way that I can. And so having all the sort of science behind it, that's one piece of it. So, many people are really kind of averse to the field of oncology, kind of driven away by it because it's very scary. It's a very scary diagnosis. And, but I feel more drawn to people. And I guess, I like to fix things. I think most people in healthcare like to fix things and make things better. So I'm first, again, drawn by an empathy and compassion for families and want to do everything that I can for them. And so then that's where I view, the treatments that we have and the diagnostics and so forth, those are tools. Those are all tools that I have to learn more about every day. And that's a big part of what you bring to oncology. But as I've spent time in the field, what I've really liked is that if you're going to be good at it, or at least be able to sustain being in the field, it's important to really bring parts of yourself, more parts than just kind of our cognitive. So, for example, I always spend a lot of time getting to know a new patient, a lot of time, because I invest a lot of time in the relationship, even if it's something that's highly curable, like an early breast cancer, because that time it's an investment because it will help kind of demystify the whole experience for patients. And those with more serious disease, that we're not going to cure, the time that spent getting to know them and know like their family support and their community support system. I've just found that over the time of that relationship with patients that it basically comes in handy.
Basically, what you are trying to say is like being a bridge between the, diagnosing and the treatment to, helping them understand what the diagnosis is and come in terms with the, you know, because this is a life altering diagnosis that can change the life of, the patients and the family. So you want to be a bridge that can help them, um, you know, get used to or adjust to this new life that is like after the diagnosis.
Yes, I mean, as you've seen in school, every healthcare professional has a different approach to patients. I went to medical school later in life. I won't say what age, but I was older. But that was actually a really big advantage, I feel, for me, because I already had I had a lot of life experience. I had young children and husband and whatnot. And so I think that life experience just really helped to know that people are not just their diagnosis. And I never wanted to be an oncologist or a physician that kind of was just there to convey information. Here's the diagnosis, here's the recommendations, boom, on to the next person. I've tried not to do that. So I do, like I said, spend a lot of time getting to know people and those things are actually, they're very important.
Yeah, it
People's,
is. Yeah.
what their social support structure is,
Mm-hmm.
what their faith system
Yeah.
is, that's really important. Because they're going to need all those things, and it's important for us, because it's a team,
Yeah. Yeah.
to know what people have, so that
Mm-hmm.
when they need additional help,
Mm-hmm.
we can tap into that.
Yeah. Yeah.
And then you mentioned kind of educating patients about their disease. That I feel has always been really important.
Mm-hmm.
But I will ask people up front what they, because some people don't really want to know anything, or
Yeah,
they
that
might
is.
defer that to a family member.
Mm-hmm.
Other people want to know a lot, so I try to probe and kind of what information they want to know. And I feel it's very important, if patients and families want to know, be educated and know as much as they can.
Mm-hmm.
That's actually, as you know, in many disease conditions, that's really important. So, for example, the more a person knows about diabetes or
Yeah.
hypertension and managing those things, the more compliant they're going to be.
Yeah, that's true.
So it isn't just that I want them to know things. Most people are really more compliant with what you're going to be recommending,
Mm-hmm.
if they're educated about
Yeah.
their disease.
Yeah, that's true. So, like, uh, in your opinion, like, what do you think the most important quality a doctor should possess?
Boy, it's hard to have one
Yeah,
for any
that's.
of us, but if I had to boil it to one, I think I would say the ability to listen. I
Yeah,
think that
that's.
listening is, it's hard to slow down and listen. The pace of life and the pace of healthcare is
Yeah.
such that it can often just be about, you know, asking, extracting information.
Mm-hmm.
But uh, yeah, I guess I would say listening.
Listening.
It
Yeah.
Because there's a lot of things that go along with that,
Mm-hmm.
empathy, compassion,
Yeah.
and so forth. But I think listening, yeah,
Mm.
because it's a very powerful tool.
Yeah.
Sometimes, in many situations, especially in oncology, it's the only tool that we have, right?
Yeah.
If a patient gets to a point, or they're at a point when you first meet them,
Mm-hmm.
that there's not a lot of, they're not suitable for treatment, or there's just not a lot that we can do at that point, listening can be a very powerful
Yeah.
tool.
Because communication is the most important aspect of it, and only if you listen, then you will know what the patients know, what their views are, and what they want from their treatment. And so, I think that's very important quality a doctor should have. What advancement in oncology over the years that have been most exciting or impacted in your life, or like overall in the field of medicine?
Gosh, that's another. You ask great questions, Keita. Yeah, so I finished my training in 2003, I think,
Uh-huh.
so 2002. Eh, You know, I mean, so in the early years when I was out and practicing, we were, the age of what we call targeted therapies.
Mhm.
Until the early 2000s, for decades, we just had chemotherapy drugs. We call them the cytotoxic drugs.
Oh
They
yeah.
basically kill cells. I mean, that's what we relied on for
Mhm.
many decades. And those are great drugs, but they come with a lot of side effects. And so people, very smart people, have been working for a long time to find something that's better,
Yeah.
something that is more targeted at the cancer itself and can spare the patients a lot of the side effects.
Mhm.
So in the early 2000s, we saw a lot of these new sort of targeted people figuring out, what is driving this particular cancer, whether it's breast or ovarian or stomach cancer or whatnot.
Mhm.
What is driving this particular cancer, and can we come up with a smarter drug?
Mhm.
You could call that magic bullets. We don't really have magic bullets yet,
Uh-huh.
but those targeted drugs have just gotten better and better
Mhm.
over the years. I would say in my career, though, probably the biggest advancement has been all these immunotherapies, essentially
Immunotherapies.
using, people have known for hundreds of years, actually, that our immune system is a very important part of, obviously, keeping us healthy,
Mhm.
but keeping cancers at bay. And,
Yeah.
and so understanding how the immune system works and kind of harnessing it in really very helpful ways, And then again, sparing patients a lot of side effects. I mean, some of these drugs are nothing short of miracles. They really are. So I think they're going to continue. So the targeted therapies and the immunotherapies are just, I think, going to continue to get better and better over time.
Okay. So as of now, like they both are like used as a combined therapy. Like
Well,
at the
I mean, every cancer's different.
mm-hmm.
You know, when we learn what works in
Yeah, yeah.
individual cancers through clinical trials.
Mm-hmm.
Um, so yes, in many cases, the combination of, say, a targeted therapy and an immunotherapy has been really pivotal. And
Mm-hmm.
so I'll give you an example. I worked for many years on liver cancer, hepatocellular carcinoma. I mean, when I started my career again 20 some years ago, there was not very liver cancer. HCC was considered, it was a death sentence. I mean, because most patients have underlying liver damage,
Mm-hmm.
and so they've got two major things going on. You know, a liver that's failing on them or is very damaged. So you have to be very careful in what you treat patients with.
Mm-hmm.
So, because it was such a bad disease, the combination of liver cancer in a damaged liver,
Mm-hmm.
a lot of people in the oncology field just thought that it was kind of an unsolvable problem. Um, and, you know, those patients can't tolerate the cytotoxic drugs
Yeah.
because our liver is so important for those.
Yeah, yeah.
But with really dozens and dozens of very thoughtful clinical trials, first looking at some of the targeted agents.
Mm-hmm.
So one comes to mind. There's a drug called bevacizumab, which is very commonly used in colon cancer, lung, stomach, ovarian. And what it targets is abnormal blood vessels. So cancers, we know, they have a very distorted blood supply.
Yeah,
That's
yeah.
part of what makes them cancer.
Mm-hmm.
So bevacizumab, it's not really known how it works, but we think it helps kind of remodel those abnormal blood vessels and therefore help other drugs to get to the tumor better.
Mm-hmm.
So one big trial that's been game changing in hepatocellular carcinoma is a combination of that bevacizumab and one of the immunotherapies has just shown remarkable results. So that's a good example actually of
Mm.
what you've mentioned of, yeah, using targeted therapies with immunotherapies
So it
in
depends
combination.
on which type of cancer it is and like which works the best for the patient.
That's right. Yeah. You know, there's so many mysteries
Mm-hmm.
still and unknowns in the field of oncology, which, you know, makes it challenging.
Yeah.
You know, we'd love to have everything answered. We'd love to cure cancer. We're
Mm-hmm.
probably not going to quote cure cancer, but we're definitely making progress.
Mm-hmm. And that's a win, I must say, because like if we compare from the early 90s to now, we have come a far way, right, in
Oh,
the field of advancement in terms of treatment and everything. So I would say in the future days, in maybe next to 5, 10 years, we'll be more advanced in such forms, different approaches to treatment. So that brings me to our next question. Like, as you have all these like 20 plus years of experience in this field of medicine, and how has your views changed on life, health, and mortality, because it's something you deal on everyday basis being a healthcare professional. So how has your views changed over the years on life, death, mortality?
great question, Gita. So I think during, you know, we all grow and evolve as we
Mm-hmm.
get older.
Yeah.
During my training, which is 10 years, you know,
Mm-hmm.
medical school, residency, then fellowship, I was definitely always focused on the next thing, you know, on the next step, on the next exam, on the next rotation, you know, the next step in training, kind of, you know, not really focused on being in the present, living in the present.
Mm-hmm.
But as I've gone through my career and taking care of people and really realizing that tomorrow is not promised to
Yeah.
any of us,
Yeah.
which is, it's so obvious,
Yeah.
but
But
yet
we
it
take it
can be
for granted. Yeah.
yeah, it can be a very hard thing to accept
Mm-hmm.
on a personal level.
Yeah.
You know, and there's aspects of medical training that can make you feel sort of invincible and, you know, I'm healthy, so therefore I'm going to be around for a long time and all of that. But so taking care of patients has has really helped me try to accept that because I see it in front of me every day. Someone, for many people, aspects of their lifestyle or their family history or their genetics, sort of were big contributing factors to why they got a particular cancer, even though acknowledging that we really don't know, we don't have great proof of what causes cancer. It's multiple factors. But especially here, when there's so many young people, young people in their teens, 20s, 30s, with cancers that should be affecting, that are much more typically found in people older, 50s, 60s, 70s. But yes, when I sit with someone and the message is brought home, tomorrow's not been promised. It's not been promised to that person. It's not promised to me. So it's helped me try to be more in the present and not always be thinking about kind of the next thing.
What's next?
Yeah. So in that way, and I think that's something, it doesn't, at least for me, it's not like a light bulb goes off. It's a lesson that I have to really kind of reinforce every day because, human beings, we're planners, and we think in the future and we want to try to control things and control our environment. And so it's a lesson I have to reinforce all the time and come back to the present. But actually, I feel that's been one of the gifts of being an oncologist and taking care. I think if I worked in another field and didn't have that lesson reinforced so frequently, I don't think I would be learning it. So that's been a gift, actually. It's one of the many gifts that I've received from patients.
I very much agree with that because nothing is promised tomorrow, and like we are so like busy to like achieve what's next in our life, and that we forget that we forget to live today, and we forget what it is like present in front of us. So I think that's a very important lesson that we have to like remind ourselves time and again to live and be in the moment, right?
Yeah.
Let's shift some gears and talk about you as a person. Like I know a medical oncologist, a professor, these are the essential components of who you are as an individual. But apart from that, like what are your hobbies or your interests apart from medicine?
Well, it's a long list, actually. So as people know, I love everything outside.
Uh-huh.
Just
Yeah.
so I was a runner back in my 20s. I ran a couple of marathons, and just I've always liked being outdoors, hiking,
Uh-huh.
bicycling. I've done a little bit of mountaineering, and I'm
Very
probably aging
interesting.
out of that
Mhm.
sport, but really anything outside.
Just be
Is
in touch with nature.
Yeah, just to be active because
Hmm.
these professions where we're inside all day.
Yeah.
It's therapy, just
Mhm.
being out in any weather and moving. That's really important for my mental health and obviously
Yeah.
for physical health. Um, and I've probably done kind of more and more as time has gone on. Many people, for a variety of reasons, they'll be maybe very active in their 20s, 30s, 40s, and then start to slow down. And I guess I'm probably taking on more things now.
Yeah.
I
Yeah.
did the trek to Annapurna Base Camp in
Yeah. Yeah.
October and
Yeah. Yeah. You
was
share
the
the
oldest one
pictures.
on the group.
Hmm.
But I kept up with everybody. So I get it from being a physician and seeing people. Age really is just a number,
Yeah.
and
It's number.
a lot of how people age comes down to lifestyle,
Hmm.
and so I've just learned it's really important. It doesn't really matter what you do. It's just to move and stretch and, just try to stay as physically active as possible.
Yeah.
So yeah, I like all kinds of hiking and seeing new places and
Hmm.
adventures, things like that.
So I know you have, been to a lot of places here in Nepal. So like be it the trek or hiking. So what has been your most favorite by far in Nepal? Be it a trek or hiking or
Oh gosh,
any of those.
that's another hard question because it's like asking like who's your favorite child, right?
Yeah.
Especially in Nepal, there's so many beautiful places.
Mhm.
And so we're in eastern Nepal, which
Yeah.
most people are not really very familiar with. I had to
Hmm.
find Dharan on a map. Um, so I've really enjoyed, we're right here in the mountains, and I've really enjoyed just getting up into the mountains, Recently, I was out to Elam, out to the tea garden
Mm-hmm.
area, and climbed Pativara,
Pativar. Yeah, yeah.
which was just beautiful. And it
Mm-hmm.
was a beautiful, clear day, and to have the Himalayas visible, up to the north. So
Yeah.
that was a high point. I think of my 5 months, though, the Annapurna Base Camp trek was,
Annapurna
yeah,
Base
because
Camp.
that was with a wonderful group,
Mm-hmm.
a couple from Canada, and then some um, folks from the U.S.
Mm-hmm.
And it was a busy time because it
Yeah.
was during Dasein.
Oh, festival
Yeah,
time. Yeah,
yeah, it
yeah,
was during
yeah.
festival
Uh-huh.
time, but it's just a spectacular.
Yeah. That's a dream come true to witness that amazing view.
Yeah.
Let's have a little fun like question I want to ask. If you weren't a doctor, what other career would you have pursued if not for a doctor
Oh my
or
gosh.
not in the medical field?
Yeah. So I actually had a career before medicine.
Really?
Yeah. So when I was a teenager, I thought about all different things.
Uh-huh.
I was interested in marine biology. I was very interested in the environment and
Mm-hmm.
environmental protection. So this was the 70s and 80s, and
Mm-hmm.
there was just beginning to be awareness of we were not treating our environment very well.
Mm-hmm.
So actually, in my kind of college years, I thought about medicine. I actually didn't really think that I could do it. I didn't think that I was smart enough or dedicated enough. So and I was very, very drawn to the environmental field. So
Mm-hmm.
I got a master's in it was environmental engineering. It was kind of a little bit of a hodgepodge of things,
Uh-huh.
but at any rate, so I worked for various environmental consulting firms for a number of years, and then my last position before leaving and going into medicine was I worked on what was called the Boston Harbor cleanup.
Mm-hmm.
So the Boston Harbor for centuries really had been used as a sewer for eastern Massachusetts. All kinds of wastewater just went directly into the harbor.
Mm-hmm.
You would never swim in Boston Harbor. So anyway, there was a multi-year effort to clean it up. And so I worked on a component of that for a few years. And then for a variety of reasons, just started thinking about okay, this is wonderful career, but do you want to do this sort of forever?
Mm-hmm.
And just gradually became drawn back to my original idea of medicine, and then went to medical school and so forth. So other than that, I, I sometimes I thought about that, like what other careers, I've thought about things like outdoor education,
Mm-hmm.
kind of fusing that love of the outdoors with getting young people out into the outdoors. That I've kind of thought about. Um, I do a lot of crafts like quilting and
Oh, that's
sewing and
interesting.
things like that.
Uh-huh.
I never really thought about that as a career, but
As a
staying
hobby.
home and doing crafts
Yeah,
all
yeah,
day
yeah,
would be kind of fun.
yeah. Mm-hmm. Yeah, it's
So I'm
nice.
I'm very I'm so fortunate actually
Mm-hmm.
in that medicine really was the best career for me, and you know I went to medical school in my mid 30s, late 30s.
Mm-hmm.
That's a time when many people, most people have been working for at least a decade, and
Yeah.
it's a time when many people go through a questioning process of,
Mm-hmm.
whatever they pursued, was it the right thing?
Yeah.
Because it's hard to make a choice in your 20s.
Mm-hmm.
It's very hard to just
Yeah, yeah,
commit to something that's going to be your lifetime
yeah.
professional occupation. So I met a lot of people who were kind of going through a questioning process, and for most people, they're not really able to make a change. They've they've got student loans for whatever they've already pursued.
Mm-hmm.
They might have a family, they have financial obligations, and they're not able to make a pivot that I was able to make.
Mm-hmm.
So I've been very grateful all these years that I had a chance to kind of have a midlife crisis and
Mm-hmm.
be able to act on it.
Yeah.
Yeah. So I know I've been very fortunate, and many people, just were not able to make a change and
Yeah.
had to find their happiness in what they were already doing.
Yeah, because in your 20s and 30s, you have this pressure of, figuring things out and getting settled. That's the pressure that one puts on themselves as well as
Hmm.
from the society or family. And I'm like so glad that you didn't gave into that, and you were able to find what you truly meant to do. And I'm so happy for you that
Oh,
like you
thank
found
you.
your true calling.
A
Yeah,
calling.
true
It's definitely
calling.
a calling.
Yeah,
Yeah.
yeah. If you could invite three people to a dinner, be it alive or historical, like who are those person you would like to invite to a dinner?
Abraham Lincoln.
Okay.
Abraham Lincoln.
Uh-huh.
Yep. You know, one of the presidents of the
Yeah.
United States who
Uh-huh.
ushered us through, the end of the U.S. Civil War. Slavery didn't end in one day or month
Yeah.
or year
Mm-hmm.
or decade, but so Abraham Lincoln,
Mm-hmm.
probably Winston Churchill. Just so many
Winston.
stories. So he was a prime minister.
Okay.
He was prime minister multiple times
Uh-huh.
in Great Britain, and ushered that country through World War II.
Uh-huh.
And probably the Dalai Lama.
Uh, I know you are like very much into Buddhism. You spoke about
Study
it.
Buddhism, yeah, a
Yeah, yeah,
lot,
yeah.
as much as I can.
Mm-hmm.
There's so many, but yeah, those are the three that come
Three.
to mind.
Okay, interesting. No, you have spent a significant amount of time here at Dharan, and especially you are here developing the curriculum for DM oncology program.
Hmm.
So, like, how has the experience been in the process of developing a curriculum?
So before I came, I had a lot of ideas about things. I had done a program a couple of years ago at Duke, that was actually focused on curriculum development.
Mm-hmm.
And what I did in that program, so in oncology in the US, we have the benefit of a lot of what we call APPs, advanced practice providers. They're also called mid-level providers. So nurse practitioners, physicians assistants, I mean, they augment our workforce. They're a hugely important part of delivering oncology care,
Mm-hmm.
really all medical care. And we have some fantastic ones in our group at Duke. But several years ago, I realized, we hire a new nurse practitioner, let's say,
Mm-hmm.
and we plop them in our clinic, and then they're kind of on their own to learn the field. And that's very common. It's not just oncology, it's
Yeah.
very common. So anyway, I started to put together, I thought we could do better at helping to it's not just orientation, but what do we expect them to
Mm-hmm.
know?
Yeah.
Do we expect them to know everything that a board certified oncologist knows?
Mm-hmm.
Or so I did this certificate program there, and put together curriculum for APPs so that they could study up on anemias and all the same topics
Mm-hmm.
that we cover as oncologists. So that's when I really became interested in curriculum development, because again, it's meeting a need.
Yeah.
So when I came here, I had all kinds of ideas about. So I knew that one of the limiting factors here was the number of faculty that you have. There's so many patients, but you
Mm-hmm.
really just have the two
Yeah.
medical oncologists.
Mm-hmm.
So, so curriculum consists of all kinds of things. So, key articles and guidelines and didactics and so forth. So, but one of the things I thought about is, okay, how could I augment, like add to Dr. Sonia's and Dr. Rajiv's ability to do cases, because we learn so much from cases, from
Mm-hmm.
talking through
Yeah.
cases.
Mm-hmm.
So I had this idea, which now I kind of laugh at, but that's okay, that I was going to use ed tech. As you know, there's all kinds of amazing ed tech now,
Mm-hmm.
educational technology
Uh-huh.
that you can. So I thought, all right, well, if they don't have time to really work with this DM resident
Mm-hmm.
on cases, so I was going to create a lot of cases that the resident could then kind of work through on the computer on their own.
Mm-hmm.
Um, but then when I came here, I did a little bit of work on it before coming. So when I came here, in keeping with our theme of listening, I really didn't do anything. I didn't do anything except try to listen
Uh-huh.
for the first couple of weeks. I went to rounds and just observed and
Yeah.
listened. And so through that experience, I realized they don't need cases made from ed tech. You all have amazing clinical material here. And as part of that observing process, I saw what amazing teachers Dr. Sonia and Rajiv and all the other medicine faculty who I've met. Because of, the limited resources here, if we're talking through a case, they spend a lot of time on the case. What's the history? What's the presentation? What's the exam? What's the differential diagnosis? They don't just leap to what test are we going to get, which is really what we do a lot of in the West. Is we just kind of jump to, what's the next test or image that we're going to get. So that was eye-opening to say, okay, you had this idea that you thought was going to be great with a goal of being helpful.
Yeah, that's right.
But then I just abandoned that because I said, no, they have, again, incredibly rich clinical material that they are really spending time working through. So I tried to focus more on, again, how to augment that with, papers and whatnot.
So like hands-on, experience with the patient itself, and that is how we learn. And
Yeah. So again, the first couple of weeks, I really just tried to listen and learn as much as I could about what what this program's all about. What do you have? What do you face? Those kinds of things. And then, so I laid out a whole schedule. So I mean, a curriculum is kind of a big undertaking.
Yeah.
Because you want to cover, the basic science. And so all the basic sciences, and then obviously they have to know about all the different types of cancer and all the different types of hematologic malignancies, and then chemotherapy is a huge topic. So I laid all this out in kind of an outline and, made a schedule for myself. And talking a lot with Sonia and Rajiv, like what would meet their needs. And one thing that we decided early on, which I think was a good thing, is that the goal of putting a curriculum together is not to sort of spoon feed information to anyone. But obviously, you can't do that. Any field of medicine is too vast. It's not, unless you say, here's Harrison's internal medicine. No one does that in internal medicine training. They don't say, here's this textbook. Go read this textbook, and then you're an internist. So we realized that curriculum materials, they're meant to kind of highlight the things that we feel are sort of most important, lead people, provide resources, provide links to things, establish expectations for, learning objectives, what we expect people to know. So that's kind of the basis of the curriculum.
So like, how far are you done with the curriculum right now?
Oh gosh, another great question. So it was about a 10-page outline, again, all those topics. So, and actually we had quite a bit of material that already existed. So Sonia and Rajiv I had a lot of talks, didactic sessions that I brought with me. They had a lot. They had volunteers coming to their DM program at NAMS in Kathmandu. So we had a fair number of things I pulled together. So I just updated a lot. So I've completed, I would say, 90+% of all.
That's amazing.
I want them to. I want to leave them with knowing that they have all this material. I mean, we'll update it, but all the key sections. So again, all the basic science, pathology, imaging. There's a whole section on clinical research because the DM resident would do a research project. Chemotherapy, complications, oncologic emergencies. There's a few sections, that are not my expertise. So, for example, pediatric dosing of chemotherapy, we'll get a specialist to put that together. A field that's called AYA, adolescent and young adult oncology, that's really evolving to be kind of a field into itself. So we'll have someone put that together. So there's a few things that I purposely didn't put together because I want to find someone who's better at it than I am. But I would say about 90%.
That's great.
I've been uploading a lot of things recently, and just kind of, oh my goodness, this really is
So it's like
something.
you have been working on it ever since you have reached here. So it's like your baby coming together, right?
It is,
Like,
yeah, yeah. It's not quite like birthing
uh-huh.
a baby. It's
Uh,
taken longer than that, but
okay, okay.
yeah. So again, I set out in the beginning, knowing that it was really kind of a daunting task. Like, how can, and it isn't one person.
Yeah.
So, for example, the Two World Cancer
Mm-hmm.
group that was here a couple of weeks ago,
Yeah, yeah.
they have contributed some talks on palliative care, which has just been wonderful. Any curriculum benefits from all inputs from different people. But yeah, so in the beginning, I said it. I made myself this very detailed, essentially an index. What are the resources? And I made a schedule, and I didn't always stick to it, but it's like any big undertaking.
Yeah.
You could either get overwhelmed by it and
Mm-hmm.
become paralyzed and not do anything because it's too overwhelming, or I just said, okay, I'm just going to chip away at this, chip away at this, chip away at this,
Like
and
one day at a time.
yeah, one day
Yeah.
at a time,
Yeah.
finish something.
Mhm.
Um, and then over time, I also became a little more discriminating is not quite the right word, but again, keeping with the theme that we're not trying to load every bit of information about all
Mhm.
these oncology topics. We're just trying to introduce the highlights and what's important, and then rely heavily on self-directed learning on the part of the DM resident.
Yeah. Like now, as I'm hearing you talk about all this curriculum, I'm like registering the fact that oncology itself is just the umbrella term because
Yeah,
it's a very large
yeah.
field, and you building a curriculum in itself in such a vast specialty, it's a monumental task in it itself, and that's just very commendable for you to do that.
Thank you.
As a nursing student myself, like I would like to hear your advice on someone who's just starting out in the field of healthcare. What's a piece of wisdom or advice you would like to pass on to the next generation of, health professionals?
Oh gosh, great question. There's probably not just one,
Yeah. Okay.
but
Okay. Top three.
yeah, no,
Yeah.
that's
No,
okay.
it's fine.
Um, I think some of the things that we've kind of already
Yeah.
talked about, that you kind of only get the benefit of looking back. But one is definitely is just to be in the present, and I've actually learned so much from nurses, from
Mhm.
nursing over the years, because you are nurses are present with patients.
Yeah.
They're
Mhm.
there 8, 12, 16 hours a day,
Yeah.
and we kind of pass through and so be present with the work.
Mhm.
Um, but also, the concept of self-care, of taking care of yourself, that seems like it's becoming more important in the last few years. And, previously in healthcare training, and it still is a factor, we're expected to do superhuman things, and yet
Yeah.
we are human beings.
Yeah.
And, that analogy that is quoted a lot, that they'll say on the airplanes, put the oxygen on yourself first and then put it on the person next to you, your child or whoever it is. It's a great analogy
Mhm.
because if we don't take care of ourselves,
Yeah.
mind, body, spirit,
Mhm.
how can we be expected to
Yeah.
show up and take care of other people?
That's so true. Yeah.
Yeah, so
Mhm.
the self-care, building in, I'm important, and
Mhm.
my self is
Yeah.
important to what I do every day, will help, sustain you through,
Mhm.
because the burnout rate in
Oh,
healthcare
yeah,
is high.
yeah.
And, the cost to enter the field in terms
Mhm.
of time devoted and so forth is high. So we you know so that's really important, self-care.
Yeah.
And then you did let me have three. I guess self-care extends to our colleagues.
Uh-huh.
I've been in places where it's not there's a lot of tension.
Mhm.
There's just a lot of sort of conflict
Yeah.
among people, and it's so much more pleasant and productive to be in an environment that which I have found here, which I've just loved,
Mhm.
where colleagues really care about each other and
Mhm.
watch out for each other, and
Yeah.
it's not a competitive environment, it's a
Mhm.
caring environment. And we each of us has a role to play in that. Each of
Mhm.
us can bring that to the
Mm-hmm.
people that we work with, of just being, a caring human being.
Mm-hmm.
And so that's one of the things I've loved
Yeah.
about here, because I feel as though you all really truly care about each other, and it
Mm-hmm.
it shows.
Mm-hmm.
It shows, and it's just really heartwarming, because you will all bring that
Mm-hmm.
to your profession. You will bring that to patient care.
Yeah. Like, be your friend that you'd want to have at the end of the day, right? Yeah. And I think most of the people forget that behind that white coat, we all are humans at the end of the day.
Hmm.
And like you mentioned, self care is, I think, very important for not only the patient itself, but for the health professionals as well.
Oh,
Yeah.
absolutely. Yeah.
What would you say to someone who is, thinking of pursuing a career in oncology?
Well, yeah, so I lots of things, obviously. I mean, if they're interested in it, just to, and this would hold really for any, whether it's pediatrics or what they're thinking about, just be exposed, expose yourself to something. One of the challenges I've seen both here and in the US, in training, we're not exposed to everything,
Mhm.
or it might be very, very limited exposure. So how can you know, so if there's a spark of interest, go pursue it, do a rotation in it, you know, uh, just be expose yourself to the
Mhm.
field, and really think through what is it that you are looking for
Mhm.
in a field, sort of what we talked about earlier, the long-term
Yeah.
relationships, or and what resonates. Again, the decision of is such a mental decision so often. What kind of schedule do I like? What kind of money am I going to make? Those kinds of things. What kind of colleagues do I like to interact with? That's a really cognitive level of picking oncology or any
Mhm.
other field. But I do think it comes down to it's a calling. It
Yeah.
really is a calling,
Mhm.
and I think a calling is something that you have to just kind of ask your inside.
Mhm.
Okay, I've thought through all these cognitive parts of the decision,
Yeah.
but does it really resonate with me? When times are tough for whatever reason,
Mhm.
am I still gonna love this field?
Yeah.
Am I still gonna, I shouldn't say love this field, because we're not all going
Mhm.
to love it every day.
Yeah.
That's
Yeah.
just the
Not
reality.
every day is a good day.
No, not
Yeah.
every day is a good day, but
Mhm.
I think where the calling part comes in
Mhm.
is, where do I feel like am I making a difference? Am I needed?
Mhm.
Is this field kind of the best use of where I can put
Mhm.
everything that I have to give into this field? I think that's
Uh,
kind of
mhm.
a bottom line.
Yeah. I think like once you realize your own potential and what you want from your life, I think that's one of the privilege that one can experience because I think in this world like a lot of people are there who are still in their 50s 60s and they are still unhappy with their life or where they are in their life. So I think like you had your true calling, so I think that is one of the, I would say, the luckiest experience that you can have
Yeah.
because that is where like you find what you want to do and like what you can contribute. So I think that's an amazing thing in itself, and I hope that we can also in the future find what our true calling is.
Oh,
Yeah.
I agree with you
Uh-huh.
100%. Yeah, many people for many, many reasons
Mhm.
arrive at
Yeah.
midlife and older, and, their work was just a job.
Yeah.
And, not everything, I guess, is going to be a calling, but yet
Mhm.
at the same time, eh, we've all met people who do jobs that we might consider mundane or not
Mhm.
particularly interesting,
Yeah.
but yet they are contributing. They have found, whether it's just being kind to everyone that they
Mhm.
encounter
Yeah.
in that job,
Mhm.
that that's been their calling. And yeah, there's really kind of, it's an amazing gift
Yeah.
to feel like you're living your calling.
Mhm.
So I have a feeling, everyone that I've met in the students oncology wing,
Mhm.
because I think part of a calling is listening,
Yeah.
right?
Yeah.
Is
Yeah.
listening to what my gut, whatever we want to call it, my
Mhm.
soul is
Yeah.
telling me.
Mhm.
So if you're tuned into that,
Mhm. So more of
Because
a
you
self-reflection
can't
you need
hear
to
a
do.
calling if you're not listening,
Yeah,
right?
yeah. So a lot of self-reflection, introspection needs to be done
Yeah,
for that.
yeah, yeah.
Yeah.
What do I like? What am I good at?
Mm-hmm.
I think one of the hard parts of this is, especially healthcare, but any kind of higher education. So much we're just taught that we're not really good enough, or that there's kind of in keeping with what you were talking about of the always thinking about the next thing. Much of our education system is so sort of performance oriented,
Yeah.
and we can take on a lot of negative thinking. I'm not good enough. This grade wasn't good enough. I need to do more. Um, as opposed to just really listening to, because we all have gifts,
Yeah.
and figuring out what those are
Mm-hmm.
over time
Yeah.
can really help a lot.
I agree. The last question would be like, what are you going to miss the most from, your time here at Dharan or overall in Nepal? Like, be it the food, the people, or any place.
Yes,
Yeah,
all of the above.
all of the above.
So when I first came here, people are asking, have you been here before? And I
Uh-huh.
had been to Nepal twice before. So I always talk about the food because I love the food.
Like
And
what food? Any particular?
oh, veg momos.
Veg
Yes,
momos,
yeah,
of course.
veg momos. But I've learned to like
Uh,
is it tupka?
Tuppa,
Tupka.
tupka.
Um, I mean, I love all Nepali food, and I can't wait to go to PK Peak because I learned about gurung bread. Gurung bread.
Kurung bread.
Yeah, it's kind of a puffy bread. It's a cross between kind of a flatbread and a
Uh-huh.
donut. Um, have you
You
ever
mean
heard? Do you
baku
know gurung
pavroti?
bread?
Baku pavroti. Okay, okay. Yeah, yeah,
Okay.
yeah. I've heard. Yeah.
So I love Nepali food,
Uh-huh.
but I would have to say it's the people, and
Mhm.
the people were definitely a big reason why I love this country and why I always wanted to come back. It's they're just the nicest, kindest, most gracious people that I've ever encountered. And it's one thing if you're here for say 2 weeks, and especially if you're here as a tourist. Of course, that's what you're going to see.
Mhm.
I think you can see that
Yeah.
anywhere. But being here in a non-touristy area for 5 months,
Mhm.
I was sort of wondering, am I still going to feel that way? Is
Yeah.
that still my experience?
Mhm.
And I would say even more so. I mean, I've been included in everything. I've been welcomed into the festivals and people's homes and included in celebrations. And yeah, so that's the number one, two, and three things that I will miss is the people.
Yeah. So at the end of the day, it's the people
Yeah,
we like have
that make
experiences with.
things.
Yeah.
Yeah, and we kind of know that,
Mhm.
right? But sometimes we don't know that, especially traveling as a tourist. Um, it can be like we were saying, the mountains. The mountains are spectacular. The food, the the colors and all. But it's the people. It's yeah. But one really nice thing is that yes, I'm going home,
Mm-hmm.
but I have all these new friends. I really feel like I have all these new friends,
Yeah.
and that we're not only going to keep in touch, but I feel like I'm part of this family.
Yeah, you are for sure.
Oh my
You are.
goodness.
Yeah,
And
there's no doubt in it.
oh
Yeah.
gosh, thank you.
Uh-huh.
I mean, to feel that, and I mean, I already have a mental list of things that I'm going to work on in the next year, to help with the conference and get funding for the conference. And so I really feel like I'm part of a family, and I'm so
Yeah.
grateful to hear that you feel the
Yeah.
same.
Right now you will just be away as your vacation from us, for a year. Next year we will be definitely meeting for the
Oh
next
gosh,
conference.
yes,
So we are
yes.
very excited about that as well.
Yeah.
Yeah.
Yeah, and to hopefully maybe be a mentor from a distance
Yeah.
of just
Hmm.
questions.
You don't need to be like
I
physically
don't I
present in
don't
order
have
to
to
be a
be here.
mentor.
Yeah,
Yeah.
I can't get as good Nepali food,
Mhm.
but yeah, that's the overwhelming feeling that I'm leaving with is how much I've gained from this experience, and I have this community now that I just enjoy so much and I admire you so much, but I also feel like I can still contribute to this community, and it's just
You
a
have
really
definitely done a lot for us, like, from being our mentor to like I know you as a mentor, but as a friend as well, like where we can share, talk, and everything. You are sharing our experiences with us, and I think that's a blessing in itself.
It's
Yeah.
yeah, absolutely a blessing.
Yeah. So I think we have come to the end of our session. So it's been such an honor to hear from you, like with your professional and the personal experiences and your absence in the future days, like even in the meetings, you will not be here with us physically, and your absence will be greatly felt. And we will surely miss you. And I hope that you have a wonderful trek before you like officially
Thank
leave
you so
Nepal.
much.
And happy holidays.
Yeah, thank you. Happy holidays to you. We keep in touch.
Yeah, we will.
Um,
Mhm.
I made at the party the other night, I made a promise. I
Yeah,
must have been in
yes,
an altered
yes,
state, but I'll restate my promise,
yes,
and that is
mhm,
when I come back next year in the
yes,
fall, that I've now loved karaoke and I love
yeah.
dancing. I'm
We can see
terrible
how
at
much
it.
you
Oh,
enjoy.
I
Yeah, you're
just
good at
enjoy it.
it. Yeah.
So I promise that I will learn to sing
Mhm.
a song, an important song in Nepali, and
Yeah.
I will sing it when I come back.
If you want, we can help this song selection as well. But
So
yeah,
actually, that would be great because
mm-hmm.
if you all can help with selection
Sure, sure.
of
We
a
can.
meaningful song.
We're happy to help you with that.
Okay,
Yeah. Yeah.
great.
So thank you so much for
Thank-
like agreeing to do this with us, and I think it has been experience as it was the first time for me as well, and to have you as our first guest in our podcast series. So thank you so much for it's an honor to have you here with us today.
Thank you so much.
Thank you.
This has
So
been fun.
yeah, we hope that you had a wonderful time with
It was
us
a
here.
lot of fun.
Thank you
Great
so
job.
much. So, to our listeners, thank you for tuning in to the human behind the healers. And as we're very privileged to hear Dr. Melanie Thomas' stories or experiences, so we will back with another episode in the upcoming days. So, stay tuned and stay curious. Thank you.